Let me know when to begin. Is this the normal number, or do you usually get a bit more?
We will start in just like less than a minute. Just I need to start record.
Okay, yeah, براحتك. Just let me know whenever.
دكتورة إذا جاهزة حتى نبدي. جاهزين دكتورة؟
نعم نعم شكرا.
بسم الله الرحمن الرحيم، والصلاة والسلام على سيد الخلق محمد وآله الطيبين الطاهرين. الزملاء الكرام جميعا، سلام عليكم ورحمة الله وبركاته. اليوم يعني جلسة جديدة من الميديكال جورنال كلوب ميتينج. صراحة ما راح أقدم هواية، موضوع جدا مهم، موضوع كل الزملاء يحتاجون يعرفوا، سواء يعني الجانب الطبي، الفيزيكال هيلث، وكذلك المنتل هيلث وبقية التخصصات. يتأثر بشكل قوي أو مرتبط بشكل كبير بالتشايلد أبيوز وأثره النفسي والجسدي، neuropsychology، اللي تقدمه اليوم الزميلة الدكتورة ياسمين محسن. الدكتورة ياسمين هي سايكاتريست في بريطانيا، عملها وتدريبها في التشايلد أدولسنت، يعني بالأطفال والمراهقين، وراح تقدم لنا الجلسة إن شاء الله خلال نصف ساعة على 45 دقيقة. تقدم لنا الورقة البحثية اللي تناولت هاي المراجعة، وبعدها راح يكون عندنا حوالي ربع ساعة نقاش على الورقة البحثية نفسها، وكذلك تتبع تقريبا نص ساعة مناقشة عن الموضوع نفسه وكيفية نستفاد من النتائج اللي حصلناها من الورقة البحثية على الأرض الواقع، أو كذلك شلون نستفاد منها ببقية المجالات. وأكيد زملاء بقية الاختصاصات جميعا مرحب بهم في النقاش، في جزء النقاش. دكتورة حياكم الله وشكرا لوقتكم وقبول الدعوة، ويا ريت تفضلون.
شكرا دكتور عبد الله. وعليكم السلام عليكم to everyone. السلام عليكم ورحمة الله وبركاته to everyone. شكرا على الحضور من كليتكم. أني راح أقدمه في إنجليزي، بحاول أترجم بعض للعربي، بس أريدكم تقولوا لي يمتى ما تحتاجوني أوقف له شوية يواش أسوي له أترجم له إذا ما أعرف دكتور عبد الله يقدر يترجم. و feel free اللي على أي وقت براحتكم قولوا سؤال أو رأي. ما يهمني، أحب يصير مناقشة، إذا هاي صحيح كلمة صحيحة. أحب يصير تكلم، وكل واحد يحكي ويصير interactive. ما أعرف المترجمة مال interactive، بس واضح. شكرا
إن شاء الله.
شكرا، الله يخليكم. فشكرا على الحضور، ما شاء الله أكو ناس كثير، وهذا الجورنال كلوب فكرة جيدة، وإن شاء الله أحاول أحضر بعد أسابيع إن شاء الله. فالورقة راح هسه أخلي على السكرين، وبعدين بالأخير خليت سلايد سمري عن الورقة. والعفو الورقة كلش طويلة بس نص references هسه هخليه يعني.
So Yasmin, you're unmuted. You are muted.
كل واحد يقدر يشوف الورقة. هسه أنت ميوت.
إيه هسه الورقة ظاهرة أمامنا.
بعدين راح أبدي من البداية. أوكي هذا البيبر 19 pages 19 ورقة. فهذا the name of the paper, the title is Annual Research Review Enduring Neurobiological Effects of Childhood Abuse and Neglect. But it's a review. It's not a systematic review. ما أعرف إذا الكل يعرفون الفرق. بس a review gathers lots of articles together and summarizes the findings. So it's a higher level of evidence because it's not just one paper, it's gathered lots of papers. A systematic review is more robust because they follow a specific system of gathering and analyzing these papers. And although this is a very good review, in my humble opinion, it's not systematic, or it doesn't appear to be systematic because he hasn't laid out his methods and said how many papers he found, exclusion criteria, inclusion criteria. فأحاول أترجم شوية من هذا، بس إذا أحد يحتاج بعد مترجمة بلزح مقوله. Actually, Dr. Abdullah, I think you would do a better job of translating that.
الله يسلمك. راح اختصر طبعا الترجمه بالمعنى ما مو ترجمه حرفيه، فقط تيسير موضوع. عندنا احنا الاوراق البحثيه يكون فيها نوع من التدرج. اكو عندنا اوراق ما قبل الابحاث السريريه اللي تكون بالمختبر، كذلك يعني على الحيوانات هاي يسموها بري كلينيكال. وعندنا الكلينيكال تتدرج من عندنا مثلا يجي ارتكل او الكيس، مثلا كيس ستادي تكون كيس وحده، اعلى منها شويه كيس سيريز انه مجموعه كيسات يدرسوها، اعلى منها تكون دراسه مثلا كيس كنترول. يعني عده طبعا انواع هوايه راح اختصرها، انه دراسه واحده تقام في مكان واحد مثلا على 100 شخص 50 شخص 70. وعندنا نوع من الدراسات اللي هي المراجعات الريفيوز. هذه تسوي شو نقول، تجمع الاوراق المنشوره خلال مثلا سنه كامله او خلال فتره معينه او خلال في مكان معين او في فتره مفتوحه، تجمع نتائج هاي الاوراق وتنظر لها بعده طرق. عندنا مثلا السيستماتيك ريفيو، هاي معروفه هنا من الطرق اللي نقول الريبوست الرصينه في انه استخراج المعطيات العامه. اكو عندنا ميتا اناليسز، يعني تاخذ النتائج وتحللها يعني بطريقه معينه. اكو سكوبنج ريفيو لها طريقه معينه، واكو هاي الاناول ريسيرش ريفيو هم طريقه اخرى. رغم اختلافها عن مثلا سيستماتيك ريفيو، قد السيستماتيك ريفيو تعتبر اكثر يعني قوه، خلينا نقول يعني مو رصانه اعتقد مساويه بس كقوه، بس لها طبعا فائدتها وتاثيرها وطرق طريقتها. والورقه بشكل عام حسب راي دكتور ياسمين من الاوراق الجيده. دكتور تفضل. عفوا، احنا ما نحتاج نترجم كل شيء، انه الزملاء هم من يعني المجال الطبي from the medical field, so I hope the majority can understand English, although it's better to mix Arabic and English, the Iraqi way of talking in the medical field.
Okay, إن شاء الله أحاول. لعد كل medics لو أكو other professions هنا
ولا like mental and physical health يعني أطباء وأخصائي علم النفس بالإضافة إلى طبعا زملاء طلبة وخريجين.
therapists as well.
نعم أكو بعض الثيرابيست.
أوكي زين ما شاء الله. بعد good mixed group. فشوف أشتديك. فأي وقت أي أحد يريد نعيد شيء لو نترجم شيء بلا زحمة قولون لو تنطون رأيكم أي وقت بلا زحمة.
يعني أي الزملاء أي واحد يحب أي مقاطعة بأي جزء أو استيضاح أي جانب كل سرور يعني.
شكرا إن شاء الله. فهذا this is an important topic like Dr. Abdullah said, and it talks about actual physical changes within the brain, so focusing a lot on the structure, and it talks about childhood abuse and neglect and the effects of this on the structure of the brain. The paper separate part of the reason why it's so long, it talks about so many different areas of the brain. هواية كثير من المناطق في المخ فيها الورقة, and also separates into male and female the effects, and separates the types of abuse and neglect as well. So that it highlights that it's not just about the presence of maltreatment, but that different types of abuse can have different effects as well, which is quite interesting and specific. فالنوعية مال أثار تختلف. The authors are Teicher and Sampson, and they're in America, and they I know Teicher likes to I watched one of his lectures. He likes to include a lot of neuroimaging for MRIs يستعمل هواية, وهذا شيء مفيد. The MRIs were functional MRIs. They can give us a lot of information about what's actually going on inside the brain. So هذا الابstract هنا عندنا background, methods, results, conclusions. So a brief summary of the abstract, and keywords. So I think this is for when someone's searching for journals and typing in keywords. For Bill introduction, he says a lot about there are studies that show various things, and initially they started out quite general, but then the changes over time of what's studied. So he's saying that it is widely known that there is an effect of maltreatment on the brain, like malfunction, and then different types of studies. So it is something that's known, but this paper is adding a bit more, and also over time different things started to be studied. So they're saying already it's known that there's a connection with the different types of disorders, and also impaired cognitive function. And in this paper, he'll talk about the areas, for example, like the hippocampus shrinking. So that can kind of tell us why there is cognitive dysfunction. And this is also an important point to note. So childhood maltreatment accounts for 45% of the population attributable risk for psychiatric disorders that start in childhood. So when they say preventable, in theory, if they prevented all childhood maltreatment, that would halve the psychiatric disorders. So that's quite significant, but in practice, it's hard to prevent it. Also, it's quite important. نعم.
بس هاي استوضح النقطة إنه أشوفها مهمة. يعني هسه هو جاي يقول إنه 45 من الحالات النفسية سكاتري يعني كيسز اللي بدايتها بالطفولة 45% منها تكون بسبب إنه اعتقد child abuse صح؟ او الchild abuse اللي ما تم معالجتها بشكل جيد، او انه بشكل عام يعني كل الحالات اللي ما تم معالجتها بشكل جيد.
نص الحالات مال حالة نفسية اللي يبدأ بالجهال، نصه من maltreatment. فإذا واحد يقدر يوقف هذا maltreatment والأذية للجهال.
Maltreatment for all like problems, not just like sexual abuse.
Exactly, yeah. Sexual, physical, emotional, and neglect. So the four main areas. So they'll go into detail about the different types. Another important area is the interplay between the mental and the physical. So often we separate it out. So this is a mental disorder, this is a physical disorder, but often they are very connected. So one of the things we learn about when we're studying for exams, board exams, is, for example, after a heart attack, so there might be an increased rate of depression, and also the presence of depression impacts on whether somebody recovers well or not. So it's very, very linked. That's just one small example. And here they're explaining that other physical disorders such as more inflammation, metabolic syndrome, cancers, heart disease, all increased with maltreatment. So all types of maltreatment. هذا الجسم بتأثير عليه من هالأشياء هم، مو بس المخ. خلي أسمع skip some لأنه شوية on time. So هذا where he's discussing about the different types of maltreatment. It's not just sexual abuse, but also can be physical abuse, emotional abuse, and here he explains the type of emotional abuse. So when somebody says emotional abuse, it can include so many different things. So it can be being verbally abusive, or manipulating somebody. So putting them in an awkward position, making them feel guilty, forcing them to do things, and also cruel things like destroying things that the child holds dearly, denigrating things important to them, and also witnessing domestic violence. That's also classed as emotional abuse, but I'm not clear مو واضحة إذا if it's accidentally witnessing or if the parent forces them to witness it. I think that might be a gray area. So so that's emotional abuse. Then there's neglect. So that can be physical neglect or emotional neglect. And طبعا it's not just not as simple as that, because in poorer countries or poorer families, they might not be able to provide things such as enough food or clothing or medical health, especially if it's not free in that country. But some parents neglect for various reasons, not necessarily because they're not capable of financially. Maybe they're not capable of emotionally because they can't organize themselves, or they're not interested. So it's more if they're not interested in looking after the child, that's more neglectful. But I guess all of it can be classed. And the emotional neglect, also that can be not necessarily the parent's fault. For example, the parent might have depression, they might have other mental health disorders or schizophrenia, and it's quite easy to neglect a child when you have this condition, which is why it's important to support mothers. And in the UK, I'm not sure if in Iraq, but we have services called perinatal services, so around the time of giving birth. So من المرأة حاملة ومن ولدت الطفل الأطباء يركزون على النساء لأنه كلش مهم شلون هي تقدر تنطي emotionally للطفل.
هذا سمحوا راح أترجم بعض النقاط.
نعم شكرا.
يعني هنا طبعا عندنا في مجال المقدمة، يعني الورقة البحثية بها عدة أجزاء. نبدأ بالمقدمة. المقدمة هدفها تتكلم عن أهمية الدراسة وشنو الأمور اللي نعرفها مسبقا قبل الدراسة. بعدها يجينا عندنا الميثود، الطريقة اللي تم بها هذا البحث. وراها يجي عندنا النتائج والملخص. لا عفوا دكتور، بس هذا هي وانا اخير شيء بالضبط. هنا بالبدايه الورقه البحثيه ذكرت انه 45% من الحالات اللي حاليا يعني مشاكل نفسيه بشكل عام اللي بدت تكون سببها حالات غير معالجه بشكل كامل او غير معالجه في وقت الطفوله. وهنا يتكلم عن يعني كم واسع من الحالات. بعضها يكون مثلا التحرش او الاعتداء الجسدي كل انواعه، سواء مثلا نوع من الضرب او شيء، او الاعتداء الجنسي، او ايضا الحالات مثلا التحرش او الاعتداء النفسي او العاطفي، واللي يشمل مثلا انه الكلام الاهانه خلينا نقول، او نخلي الطفل خاصه في وضع محرج شديد، او التنمر او كل انواعه، واللي يكون بعضه ايضا بسبب نوع من الاهمال، خاصه من اهمال الاهل، خصوصا اذا الاهل مثلا يعانون من مشاكل نفسيه متنوعه، فيكون ايضا غير مؤهلين لاعطاء الحمايه او الرعايه او توفير ما يحتاجه الاطفال. فهذا هم نوع من الاهمال او الاعتداء يوصل الى مرحله يسبب اعتداء، خصوصا في بعض الدول او المناطق الفقيره نتيجه مشاكل خلينا نقول اجتماعيه او اقتصاديه. فذني كلها راح يتركن آثار، سواء كان أنه بشكل متعمد أو غير متعمد. حضور أو مشاهدة العنف الأسري أيضا هذا له آثار نفسية على الطفل. وبعدنا في المقدمة يذكر هاي الأمور وكيف تأثيرها. طبعا ذكر أيضا أنه هاي الأمور قد تترك آثار متنوعة على الجسد، ابتداء من الدماغ وبعض المناطق بالدماغ، مثلا الهيبوكامبوس مثلا شافوا في بعض التغييرات. مشاكل اخرى في الجسد نفسه، مثل مشاكل في نوع من الايض او السمنه، او هاي الامور كلها تكون بشكل متراكم. حتى بعض الامراض انه على شكل تراكمي في حالات اللي طبعا ما تتعالج، انه يكون زياده احتماليه او خطوره حدوث كثير من الامراض من ضمنها السرطان وما شابه.
أشتديك شكرا. فهذا بعد الانtroduction وده يحكي talking about other studies that have been done in the past, بس هنا just saying what's new now. So the new area is about the structure. So not so much has been done about the structure, though we know a little bit. So I don't think we have time to go into all of this. But
of course we can cover it all. طبعا هو هنا في مرحله انه نذكر اكو مشكله قبل يتكلم عن طريقه العلاج. طريقه العلاج هاي شيء يتبع. هنا ايضا الورقه بينت انه بعض الدراسات او عندنا الدراسات اللي تمت ما غطت كل شيء، خصوصا التغيرات العصبيه. طبعا راح نضطر نعبر هواي شغلات، بس اللي يحب يراجع الورقه بتفاصيل كامله مثل ما شفت بالبدايه الورقه البحثيه، وكذلك احنا رابط الاعلان اللي نشرناه بالورقه البحثيه، الزملاء يقدرون يراجعوها بتفاصيل اكثر. هي نفسها تذكر بعض المصادر الخارجيه اللي يحب يتوسع بالموضوع. سوري ياسمين.
لا شكرا شكرا. هذا the remain.
على وقتك.
سوري.
اوكي سؤاله بالغلط. إذا سؤال عيده
لا أعتقد
بالغلط.
I think it was missed.
بخير. I remember they always used to speak about Romanian orphans when talking about attachment. And here they mention again about the Romanian orphan studies. And they did an interesting study where they actually did a control trial. So the control was leaving them in the orphanage, and then the intervention was moving them to a foster home with high level care. And that showed actually that some changes were reversible. So that was quite useful.
طبعا هسه هنا ذكرت عن دراسة أو موضوع معروف اللي هو الأيتام الرومانيين، وكانت نوع دراسة من نوع من اللي يسموها دراسة مقارنة كيس كنترول. البعض مثلا تركوهم في منطقتهم أعتقد، بس هاي الدراسة هنا مذكور منها شيء سريع تفاصيله ممكن اللي يحتاج بالرابط الموجود، زائدا أنه بعض الأيتام نقلوهم إلى منطقة فيها خدمات صحية عالية وقارنوا النتائج.
Shukran. And this next section, still in the introduction, talks about the hypotheses and the theories of why changes might happen. So can also be interesting as well. So that talking about different.
Yasmin, I believe you don't need to go step by everything. Just you may give a brief summary about this part or what it may say.
Okay, shukran.
You don't need to read it like part, just make it easy for you.
Thank you for that. Shukran. Okay, so the hypothesis, and then so he's now going into the study itself. So the first structure that he talks about is the hippocampus. So what we know about, usually what we hear about, is the amygdala, and that's something that I've heard about a lot. But the hippocampus, we don't really hear too much about the impact of abuse on it, but they're showing that there is definite change. So with the hippocampus, it shrinks. And طبعا the hippocampus is involved in memory, التذكر مع الأشياء، فهذا يتأثر بس مو بس تذكر بس also so autobiographical memories, retrieval of memories, but also internal positioning for spatio-temporal representation of places, routes, and experiences. So all sorts of memories, not just events. So he's also linked it with that they've seen changes in the hippocampus in different psychiatric disorders. So it would make sense that abuse causes problems in the hippocampus, and also they find changes in the hippocampus. But then later on, he says that actually we should think of it more as relating to the abuse. So the changes in the hippocampus are more strongly associated with the abuse rather than necessarily the disorder, because they found that some people have been exposed to abuse and they have a smaller hippocampus, but they don't necessarily have the psychiatric disorder. So he's saying link it to that, not to that. So the reason why the hippocampus... Yes.
طبعا هنا أنا أتكلم عن جزء من الدماغ اللي هو الهايبوكامبس. طبعا هاي المصطلحات نحتاج نترجمها، الزملاء أغلبهم يعرفوها معناتها. مثلا احنا المعروف موضوع الاعتداء او الابيوز، مثلا الماجدلا اللي هي اللوزه، والماجدلا اكثر معرفه للزملاء يصير بها تغيرات. الهايبوكامبس التغيرات المعروف عنها قليله انه يصير بها تغيرات. هنا هاي الورقه ذكرت انه تغيرات تصير خاصه انه شرينكينج صغر حجمه، والهايبوكامبس جزء يعني مهم في كثير من الامور. اولها الذاكره، والذاكره بكل انواعها، مو بس ذاكره الاعداء، لا ذاكره انواع كثيره منها، مثل الذاكره المكانيه، الذاكره الصوريه، الذاكره مثل نقول العاطفيه، كل انواعها. هاي كلها راح تتاثر، والتاثر ربما مو بس انه بسبب حادث معين او حدث واحد، ولكن قد يكون بسبب الاعتداء والشيء متراكم منه. أنا راكم كلام صحيح دكتور ياسمين. So is it like you meant not just about the abuse itself, but all what the consequences of the abuse affect the hippocampus?
No, sorry, I meant the abuse itself affects the hippocampus, so it's more strongly associated, it seems, than the psychiatric disorder necessarily. So it will make sense more at the end. So I'm jumping a little bit. So
طبعا هو هذا الشرينكينج او صراحه الهايبوكامبس مرتبط بمشاكل ثانيه نفسيه، بس هنا في حاله الاعتداء او الاغتصاب مثلا الابيوز الجسدي او الجنسي يكون بشكل اقوى. راح يصير اكو تفصيل اكثر مع اللاحق.
Shukran. So at the end, it will make sense, but he's discussing he's proposing an argument to treat it as a separate condition, almost treat the abuse as a separate condition, because it has its own brain changes, more so than the illness necessarily. But this is one possible mechanism why it's affected. So in the hippocampus, there's a lot of glucocorticoid receptors densely populated, and so high levels of glucocorticoids such as cortisol, which is a chronic stress hormone, can affect the hippocampus, causing it to shrink. So that makes sense. If there's a lot of this hormone and the receptors picking up a lot of it, one way might be to reduce the size, because it doesn't need as many, the brain senses that it doesn't need as many receptors to pick up, because there's a lot of cortisol present. So then that's
واحدة من الأسباب اللي تناقش الورقة البحثية اللي إنه سبب حجم أو shrinking اللي بيصير من الهايبوكامبس، إنه الهايبوكامبس فيه ريسبتورات كثيرة، عدد كبير من الريسبتورات للجلوكوكورتيكوستيرويدز، اللي هو تأثر طبعا الريسبتورات للستيرويدز هرمونز، واللي هي ستريس هرمونات الضغط النفسي والقلق والضغط أو الشدة. هذا يعني يصبح الموضوع منطقي انه من يصير عندنا ارتفاع عالي بالهرمون الكورتيكوستيرويدز، اكيد الجسم راح يشعر انه ماكو حاجه يكون في هذا المكان ريسبتورات كثيره، فيقوم يقلل الريسبتورات، والنتيجه يصغر حجم الهايبوكامبس نفسه.
شكرا. So another important aspect in a review is to discuss the strength of the finding, how significant it is. And so it seems that a lot of papers have reported this. So 30 papers have reported this finding, and they found a significant difference. Although he doesn't say whether this is clinical significance or statistical significance, there's a difference. So statistical significance is about the p-values, and it's statistics, like how much of a coincidence is this. Clinical significance is how important the finding is, but it's just said significant differences.
باختصار طبعا هنا انه كيف انه هذا الاختلاف يكون significant انه هو مميز، بس هنا يعني احد الترجمه كامل انه اكو اختلاف، مرات يكون تمييز احصائي، مرات يكون تمييز خلينا نقول نوعي، يعني من المتخصصين يرسمون بهذا الموضوع المميز. I will not go into details of this.
Okay. So yeah, majority of the papers reported it. So this is a very strong finding, and also this gives strength because it's inverse correlation. So you've got like a dose response curve almost. So the more severe the exposure, the greater the change in volume. So that gives a very good clue indication of causality. So very strong finding. So then also the differences in gender was quite interesting as well. They were saying that female hippocampi have less effect. So it's not that females are less affected by abuse in general, but just the different brain areas. So the hippocampus is less affected in females and more in males. So it's important to study the genders separately as well, because a lot of the research might be mixed, male and female, so it doesn't give very accurate.
طبعا هنا أهم نتيجة نقولها مهمة إنه فرقت ما بين الذكر والأنثى والإناث، إنه شافوا الهايبوكامبس عند الذكور صار بي shrinking أكثر من اللي عند النساء أو البنات. طبعا هذا الشيء ما يعني إنه البنات تتأثرن بشكل أقل أو يتضررن بشكل أقل من ناحية الاعتداء والأنواع، لكن هنا شو نقول هاي المنطقة عند الذكور تأثرت بشكل أكثر، أو الشرينكينج صار الحجم صار عند الذكور أكثر من اللي صار عند الإناث. اختلاف نقول ربما يكون مناطقي.
السلام عليكم.
عليكم السلام ورحمة الله.
شلونك دكتورة؟ شلونك دكتور عبد الله؟ شلونكم كلكم؟ إن شاء الله.
الحمد لله، الله يخليك.
شلونكم؟ أنا آسفة قاطعتكم،
بس يا ريت تقدموا نفسكم حتى بقية الزملاء.
زينب علي سليم، أنا أخصائية نفسية وزمالة تخصصية بالطب النفسي للأطفال والمراهقين، مدينة الطب.
ما شاء الله. السلام عليكم زينب.
هلا دكتور. هو الموضوع مثير ولو يعني بنص الشرح، بس أنا استوقفت لي هاي كلمتين ثلاثة على شغلة female gender. يعني some studies said that female gender are less يعني affected or the hippocampus less than male gender in the abuse or neglect. Some يعني if you correct me that some studies said that female are less reporting the abuse or neglect than male because of the pressure of the society or shame or something like that. If you read it, يعني if you have some information about that.
Good question. Lynn, this is true. There can be this could be called a confounding factor. So that's a statistical term. I don't know if you're familiar, but confounding factor means that there's another reason responsible for the finding. So it's
on the abuse and neglect mainly in female are but in يعني adult female mainly is domestic يعني abuse, and male more the physical abuse, or because they are more exposed to stress as they are working outside home in our culture يعني mainly.
بس قولي دكتورة، طبعا هنا الدراسة تتكلم عن التأثير العضوي، فما أعتقد هنا راح يتأثر هاي حسب ما أدري. مثلا هي قد ما تشكي أكثر، بس ما يعني إنه التأثير على الدم الهايبوكامبس نفسه يختلف. بس بشكل عام المعروف إنه تأثير المرأة على الستريس يختلف عن الرجل، خاصة هي موضوع الحمل أو هواي أمور والولادة، كون جسمها مهيئ لهكذا أنواع من الستريس أكثر من الرجل، فقد يكون عندهم adapting للستريس أكثر من الميلز.
صح.
Just opinion. ما أعرف قد هنا psychiatrist أعرف هالموضوع.
And the hippocampus, as the doctor Yasmin said, is not indicator of abuse of, as she said, يعني because it is strength in depression and in PTSD and in other يعني psychiatric disorder. So it is
طبعا أنا بس إنه هذا الموضوع قد هو الفيميلز يصير عندهم في أماكن أخرى موضوع أكثر ربما يحتاج لها تفصيل أكثر.
صح. شكرا جزيلا.
شكرا. Good question. شكرا على question. So it may be a confounding factor. So it may be true that it's underreported, but maybe not as well, because in this paper, he talks about some areas are more sensitive in females, and some areas are more sensitive in males, and also the age of the abuse as well. So there are certain ages where one area of the brain is more vulnerable, and other ages where another area is more vulnerable. So that makes it more convincing that the findings are accurate. And that's a reason, like your question is another reason why they have to justify the strength of their findings. So they have to look at lots of papers, and they have to show how they make the studies more robust. So having controls as well, and just different things to make it a stronger study. So that is important. So another thing that I found interesting here was this sums up it sums up an aspect of psychiatry where psychiatry is not just about biology, it's not just genetics, it's not just psychology, it's all of them somehow coming together. And so this kind of said it nicely, because it showed that one paper, the change was seen if people had this specific gene, so short allele of serotonin transporter promoter, and if there was a polymorphism. So polymorphism means a change in the gene. So in these males, they were vulnerable if they had this gene. So that really shows how complicated and interconnected the causes in psychiatry are. It's not biology, it's not psychology, it's all of them.
يعني ترى هنا الميلز اللي عندهم هذا النوع من الأب الوراثي خلينا نقول كان تأثرهم بالأبيوز أكثر من غيرهم.
Yeah, so the severe one was associated with smaller hippocampus, but only in males, and in males, specifically in males who carried this particular gene.
هاي المعلومة شوفها جدا لطيفة ومهمة، إنه الذكور اللي صار عندهم هذا النوع من الشرينكينج أو صغر حجم الهايبوكامبس، خصوصا اللي صار عندهم حالات شديدة من الشرينكينج اللي كان عندهم نوع من خلينا نقول الجين الوراثي، كان عندهم وراثيين نوع من الجين يختلف عن غيرهم اللي هو كان نقول ساقه أكثر من غيره، فتغير جيني عندهم أو جيناتهم اختلاف عن بقية الأشخاص. يعني بعبارة أخرى نوع من الذكور عندهم نوع من الجينات تختلف عن البقية، بالنتيجة صار عندهم تأثر انه بصغر حجم الهايبوكامبس بسبب الاعتداء كل انواع الجسدي او الجنسي يعني كان اكبر. هذا شرحته وقتها فيه. الذكور اللي عندهم هذا الجين، ما طبعا ما ذاك بالتفصيل اي جين، بس عندهم جين معين خلاهم يتاثرون بالاعتداء الجنسي والجسدي بشكل اكبر من غيرهم. لانه موضوع ايضا بجانب وراثي لاشخاص يتاثرون اكثر من غيرهم بالاعتداء، وعاده يكونون ذكور، فمحتمل يكون الجين هذا على جين مثلا على الواي كروموسوم، مثلا كروموسوم واي اللي يكون فقط عند الذكور. هاي طبعا من يمي انه كان فقط في الذكور اكثر من الاناث، محتمل انه في جين وراثي موجود بالذكور اكثر. يا ريت الزملاء البقيه اذا اكو شيء خطا من عندي يا ريت تصححوني او تنبهوني.
شكرا. And the gene is for the serotonin transporter, and serotonin is the important hormone, one of the important hormones for mental health. So one of the medications we give increases the levels of serotonin in the brain.
طبعا هذا الجين مختص بنقل السيروتونين اللي هو واحد من اهم الهرمونات اللي لها اثر ولها اهميه في الجانب النفسي والصحه النفسيه.
Shukran. And although we said that the changes were not really found in females. One of the studies did talk about changes in females, and they said it, at certain ages it's more obvious. So depends on the age of the exposure of the maltreatment. So females seem to be more affected by, I think this is specifically with sexual abuse, it's relating to if the abuse happened between 3 and 5, and not so much change to the hippocampus between age 11 to 13. And this is also partly, well, maybe partly because the hippocampus develops more when they're younger. So
ايضا واحده من الدراسات تكلمت انه بالفيميلز كان متاثر في، او يعني الاناث متاثر بعمر معين اكثر من عمر معين، مثلا اعمار 3 الى 5 سنوات تاثير الاعتداء الجنسي على حجم الهيبوكامبس كان اكثر من التاثير على الاعمار من 11 الى 13. قد احد الاسباب يكون انه مرحله التطور بالدماغ وبالهيبوكامبس تكون في بدايتها بهاي الاعمار 3 الى 5 سنوات، يكون تاثرها اكثر.
شكرا. And in teenagers, if the stress happened as a teenager, it affected this area, the prefrontal cortex, more than the hippocampus. Whereas in younger, it was an early separation. It had greater effects on the hippocampus. So again, the age affects where it happens. So
الضغط النفسي والستريس كان يختلف تأثيره بين الأعمار، يعني بالمراهقين يكون تأثير على البريفرونتال كورتكس، القشرة الأمامية أو الأمامية أكبر من على الهيبوكامبس، بينما في الأطفال الأصغر عمرا كان على الهيبوكامبس بشكل أكبر.
Sorry, I don't know why this comes up. So then he talks about, or they talk about the difference between the right side and the left side as well. In some cases, the right side is more affected. Other cases, the left side. So I think this is this bit. So personality disorder, borderline personality disorder had right-sided findings, whereas the studies with PTSD, that was right findings, borderline personality, left-sided, So adult studies with left hippocampus was in PTSD, right hippocampus was in borderline personality disorder.
بشكل مختصر انه التأثير كان حسب نوع المحفز او المسبب، مثلا اذا كان اثر ما بعد الصدمه يختلف عن اثر مثلا مشاكل الشخصيه، وكان بعضها مثلا يأثر أكثر على الجانب الأيمن من الدماغ، بعضها على الجانب الأيسر من الدماغ. ما راح أذكر هاي التفاصيل، شوي أكثر تفاصيل كثيرة ما راح أطول إذا أدخل فيها. ولا طبعا اللي يحبون تفاصيل أكثر الورقة موجودة يقدرون يراجعوها بشكل أكثر.
شكرا. But the amygdala is the next structure that he talks about, and that's one that we hear about the most when people talk about the brain area associated with pathology, psychopathology. So whereas the hippocampus shrinks, the amygdala enlarges and becomes more reactive. So the amygdala is associated with maybe more anger, more emotional expressivity. So maybe the outbursts in borderline personality disorder can be explained with a larger amygdala and the inability to tolerate stress because the amygdala is so overactive. And they did some studies using facial recognition. So they found that people with the enlarged amygdala had more reaction stronger reaction to angrier faces. So, and people with abuse had stronger reactions. So that explains why maybe certain conditions, they can be described as extra sensitive because they get these signals really firing.
هل الأميجدلا هي جزء من الدماغ أو بعض يسموها بالعربي اللوزة؟ طبعا الزملاء بدارسين أناتومي يعرفوها الأميجدلا أكثر. لها أثر قوي وعلاقة قوية بالجانب العاطفي، شافوها وهي أكثر معرفة أو نعرفها بشكل أكبر أنها تكون متأثرة بهذا الجانب. شافوها بالحالات اللي يصير لها شرينكينج بالهيبوكامبس، وخاصة بالحالات هي تكون بها تضخم. هذا التضخم ينتج انه او الاشخاص اللي يصير لهم تضخم بالاميجدلا يكون اكثر تحسسا عاطفيا واكثر استثاره عاطفيا بشكل مختصر، انه يكون مثلا اكثر عصبيه، اكثر انه نوع من الشده النفسيه، التحسس للضغط النفسي بشكل اكبر. وبعض الدراسات انه اشارت ان الاشخاص اللي عندهم اميجدلا اكبر مثلا يتاثرون بالمحفزات العصبيه اكثر من غيرهم. I saw something about autism, Dr. What was saying there.
Further up or lower?
Like in the beginning, I was talking about amygdala.
Autism. Yeah. So abnormalities in the amygdala have been observed in these conditions, including autism.
إنه هاي بعض الحالات إنه شافوا فيها كبر الأميجدلا أو تضخم الأميجدلا، من ضمنها حالات التوحد.
Autism, as far as we know, we may be wrong. Autism, as far as we know, is a neurodevelopmental disorder, so something that happens from birth, so can't be explained by this same theory. But the findings of the amygdala is the same or similar in autism. So a problem with the amygdala is related to difficulties in autism, and that makes sense clinically because often autism and personality disorder, especially borderline personality disorder, they have a few similarities. So and sometimes it can be confusing in more complex presentations. You might think, is this autism? Is this borderline or emotionally unstable personality disorder? So ability to think about other people, and also the tantrums. So you get tantrums in autism, but also in personality disorder. So it makes sense that they both have a problem with the same area of the brain. But just in autism, it's something they're born with. But in personality disorder, it's something that's developed because of the trauma.
بشكل مختصر هو بالنسبه للاوتيزم مثلا هذا موضوعنا بس كمختصر، يعني انه نظريه اللي نقول موجوده انه محتمل انه هو شيء نولد وياه ويكون مشكله في التطور العصبي للشخص. بيناتهم يعني الاوتيزم دا يشوف اكو تغيرات بالاميجدلا، كذلك بالمشاكل الشخصيه، نقول اضطرابات الشخصيه ايضا نشوف هذا النوع من التغير او بالاميجدلا، وهذا اللي يخلي بعض الاحيان واحده الثانيه قريبه وتكون بعض الاحيان صعبه نميز بيناتهم، انه بسبب هذا التغير والمقاربه بيناتهم اللي قد يكون سبب هذا التغير بالاميجدلا.
Shukran. So again, the age is important. So they're saying with the amygdala, initially there's rapid growth from after birth, and then it continues to grow and peaks at age 9 to 11 years old. So it makes sense that earlier trauma would have a bigger impact. التأثير على الأميجدلا يبدي من الصغر، لأنه هذا المنطقة في المخ دا يكبر كثير من الطفل مولود ويكمل إلى أن عمر 9 إلى 11 سنة. فهو أكثر sensitive بهالوقت. So also the theory is similar again, how it happens with the glucocorticoid receptors. So there's lots of glucocorticoid receptors in the amygdala, and so high cortisol levels again will have an impact on this, and so that can explain the difference, but it doesn't explain why it gets bigger rather than smaller.
قد يكون السبب انه احد الاسباب هو انه الاميجدلا عندهم فيها مستقبلات كثيره للكورتيكوستيرويدز، قد يكون هو اللي يخلي هذا التحفيز المستمر والعالي بسبب هذا التغيير، بس ما واضح انه ليش يصير فيها تضخم مو انكماش مثل ما يصير بالهيبوكامبس.
And this bit again is related to age. So the increased size of the amygdala was with the early exposure to emotional and physical neglect. So that's just corroborating what we've said. So there are a lot more brain areas, but I don't know if we have time for all of them. So there's the overall cortical development, the whole brain, the cerebral cortex, so the part, not the inside part, the outside, controlling a lot of thinking and planning, and also pathways as well, connecting the different areas. So the middle as well, the corpus callosum, how it connects the right and the left sides. Is also
every part of the brain affected.
Yeah.
One reason can be that every part of brain has like corticosteroid receptors.
Yeah.
الورقة كلش ضخمة وبيها لكل جانب من الدماغ أو كل جزء تشرى بقية الأجزاء، المستقبلات، الناقلات، كلهن متأثرة نوعا ما. الورقة طبعا بالتفصيل تذكرهن، ما راح ندخل في هاي التفاصيل، بس كلها راح يعني او كلها تذكر الورقه انه او تناقش بعض التغييرات من ضمنها السيربيلم اللي هو تختص بالتوازن او ما يسمى الخير. طبعا مثل ما كان اللي يحب يراجع الورقه التفصيل اكثر موجوده، راح نطلع بها.
And it's also as well as the areas of the brain, he mentioned about the dopamine. So there was another study. So all these areas, but also the dopamine, which is important when we're thinking of substance abuse and reward. So problems with dopamine and the receptors. Let's see where it is. I think it's here.
الأجزاء اللي تتأثر هو المستقبلات أو الدوبامين بشكل عام. هذا قد يفسر أحد الأسباب إنه هذا الهرمون مرتبط بموضوع الإدمان مثل ما المخدرات وكل أنواع الإدمان، وإنه هذا ما يسمى ريورد الناتج، يعني من عادة من ياخذ هذا ياخذ بالنتيجة ريورد أو عائد عن هذا الشيء اللي يسويه. هذا الموضوع راح يتأثر بموضوع بالتغيرات اللي تحدث بسبب الابيوز، وهذا قد يكون أحد أسباب أنه زيادة حالات أو احتمالية حدوث الإدمان عند الأطفال اللي يصير عندهم نوع من الاعتداء بكل أنواعه.
Hey, shukran for that. I found it a bit later. It's the reward anticipation. So they do studies with if they can delay their response. So like one example, I don't know if it's the same example. Like إذا عندك حلويات وتقول للطفل ما أعرف إذا هذا بالضبط هنا، بس هذا نفس الشيء. إذا تقول للطفل إذا تاكل واحد هسه تقدر تاكل حلوية وحداية، بس إذا تنتظر ورا 10 دقائق نعطيكم اثنينهم. بعض الجهال ما يقدرون ينتظرون. ما أعرف إذا هذا بالضبط إيش سووا، بس هذا الكونسبت مال delay.
Marshall trial. It is Marshall trial. It is Marshall trial. And by Marshall trial, when they bought like kids, some offer them a marshmallow. One, if you wait, you will get
marshmallow.
Marshmallow, sorry, marshmallow.
Okay.
Yeah, not marshmallow.
marshmallow.
طبعا هاي هسه واحدة ما يسمى بنظرية العائد أو مفهوم العائد. مثلا قد تكون هاي هي نفس المقصود أو اختلاف مثل ما قلت الدكتورة ياسمين، إنه هو إحنا الطفل إذا أعطيناه خيارين، مثلا إنه هاي قطعة حلوى إذا في تاكلها هسه أو تنتظر مثلا بعد وقت معين مثلا 10 دقائق ربع ساعة، إذا انتظرت نعطيك 2 قطعتين. بعض الأطفال يقدرون يصبرون ياخذون قطعتين، بعضهم ما يقدرون. قد يكون هذا هو السبب انه هذا موضوع العائد والدوبامين. واللي معروفه هاي طبعا تجربه معروفه المارشميلو موجوده على اليوتيوب. اطفال يجلسون غرفه ويعرضون عليهم هاي قطعه المارشميلو مثل من السماء في العراق.
اي من السماء اطيب من المارشميلو. هذا we're reaching towards the end of the paper. They've proposed eco-phenotypes. So they're saying that they want to consider maltreated individuals as their own subgroup because the changes are irrespective of whether somebody has a psychopathology or not. So previously it was said, for example, a reduced hippocampus is associated with major depression, but they found that people who've experienced maltreatment, they still have a reduced hippocampus even if they don't have depression. So they're saying describe this group differently as their own subgroup, because that can also have an implication on treatment, because not everybody who has depression has been maltreated and therefore might not have a change in their hippocampus. Whereas if somebody's been maltreated, then they might have a certain brain region that's been affected. And also, depending on the type of maltreatment, they'd have different brain regions. So it helps when thinking about future targets, way in the future targets. But thinking of the individuals as differently rather than saying.
Just if you give me a minute.
Sorry.
Please.
Yeah.
like هنا هم خرجوا مجموعة خلينا نقول مجموعة ثانوية اللي هم مثلا اللي يساعدهم سوء التغذية. يعني ذكروا سابقا معروف انه الاشخاص اللي يساعدهم كآبة يساعدهم يعني shrinking انحسار او صغر في الهايبوكامبوس. بس اللي شافوه انه الاطفال اللي عندهم سوء تغذية ايضا يساعدهم صغر او انكماش بالهايبوكامبوس، وحتى لو ما عندهم اي نوع من الكآبة يعني. بينما الامر مختلف انه اطفال الكآبة مو كلهم مثلا يساعدهم سوء تغذية، بعضهم ما عندهم مشكلة بالتغذية. So doctor, if there is a depression without malnutrition, so there is no any change in the hippocampus, or the impact of shrinking the hippocampus would be less, or what?
So I think this is a theory that they're saying. They're saying it may be limited just to the subgroup that have been maltreated, because they found that people without depression but have been maltreated have these changes, and so I don't think he's mentioned studies where it's been found, but unless I'm wrong, but I think that's the theory that they're proposing.
ربما تكون هذه نظرية انه السبب يعني او السبب ايضا متعلق في موضوع نقص التغذية في بعض الحالات. هذول نقص التغذية خلوهم على في مجموعة ثانية أو فزلوهم في سب جروب آخر.
شكرا.
هاي مجرد نظرية يعني ما نذكر دراسات معينة.
It may be that there have been studies. So he's saying that it's important to put them as this subgroup. And then we come to the conclusions. So I don't know if you want me to go through the conclusions. I'll try and do it very quickly.
So this is the most important part.
The most important, okay.
Yeah.
Yeah, so some people say just read the introduction and the conclusion.
Exactly.
Okay, so he began with lots of questions, and so the conclusions, he's got quite a few conclusions because he's looked at a lot in this paper. So he's saying first conclusion is childhood abuse has been repeatedly found to be associated with problems in the structure and function, and it's likely a causal relationship rather than if you have a problem in the structure, then you're likely to get this problem. And it's been replicated in many studies. So the second conclusion is the type of maltreatment matters. So the type affects what happens. So different studies show different areas and depending on the type of abuse. So for example, increased amygdala size or volume is specifically in some studies with neglect. So for example, having a mother who's depressed or other reasons why they've had attachment problems.
Just to like able to translate conclusions.
Yeah, sorry.
طبعا الملخص من الدراسة يعني استنتاجات كثيرة. الأولى كانت أنه هذه الدراسات كلها سوية أو كل الدراسات ثبتت أنه تأثر الدماغ والجسم يعني من ناحية المورفولوجي أنه الشكلي أو التركيبي زائدا الوظيفي بشكل واضح بسبب يعني الأبيوز بأنواعه والإهمال. الاستنتاج الثاني أنه جاء الموضوع أو الحوادث اللي صار وياها نقص تغذية كان لها نوع من التميز، خصوصا مثلا إذا كان مثلا بسوء معاملة أو إهمال مثلا من الأم اللي تعاني مثلا من نوع من المشاكل النفسية مثل الكآبة. هذه النتيجة راح يكون آثار واللي قد هو يفسر مثل نوع من التاشمنت ثيوري اللي هي ظاهرة أو نظرية التعلق، إن هذا الشخص يكون عنده تعلق شديد بالآخرين.
Shukran. And just going back to the first point, because this is also important. So it depends on the severity of the exposure and how bad the size of the neurobiological finding.
There's a relation between severity and the findings, yeah?
Yeah, the size of the findings.
So
the brain changes.
شدة الحوادث أو الضرر مثلا اللي صار يتعلق ب خلينا نقول شدة النتائج. شيء منطقي إن الحوادث اللي أشد كانت تأثيرا أو أقوى كان النتائج أوضح وأقوى. أحاول أذكر. طبعا جاي أترجم الشكل كملخص كامل قد أعبر هواي تفاصيل لأنه أول شيء مو إمكانية بالترجمة الحرفية ونفس الوقت حتى الوقت ناخذ مواد.
الثالث نقطة العمر اللي المصيبة تصير مهم لأنه different time periods the different areas are sensitive. So
هنا طبعا الأمور اللي تستنتجها الدراسة إنه العمر أيضا مهم. عمر حدوث الحالة كون إنه كل عمر إلى مرحلة التطور أو شيء يكون حساسيته أكثر. مثل ما ذكرنا بالبداية mentioned at the beginning, younger age had more sensitive for the trauma of the abuse. يعني نحن الأصغر تأثر بشكل أكبر من الأعمار الأكبر مثل ما ذكرنا بالبداية.
The fourth point, they're a little bit unclear of how long it takes after the exposure and the change to happen. So they're wondering if it can be after a few years, but the hippocampus, it says, is quicker.
عن الاستنتاج الرابع أنه غير واضح الوقت المطلوب حتى يحقق هذا التغيير، هل هو سنوات متعددة أو ربما يعني يصير بشكل أسرع خصوصا مثل الهيبوكامبس.
So the sixth point is that, oh yeah, this reminds me, this was another interesting finding. So there are changes even in the visual areas. So that makes sense with hypervigilance, for example, in PTSD. So having a more reactive one. And so, for example, witnessing domestic violence impacts that as well, because that's something that's quite visual. And so they're saying that it can be explained in terms of neuroplasticity, in terms of, so neuroplasticity is the brain changes its structure based on what it needs. So it's saying that it needs to be more reactive to visual stimuli in order to quickly escape to a place of safety. So that's one mechanism.
الاستنتاج السادس, we skip the fifth conclusion. Maybe we can say that الاستنتاج السادس انه شافوا قد في بعض الحالات يصير تغير بالجانب المتعلق بالنظر اللي هو الجانب الخلفي من القشرة الدماغية. هذا قد يكون سببه مثلا انه الحوادث اللي صارت، الصدمات او المشاكل او الاعتداءات، بعضها يكون مرئي انه يشوفه مثل الاسري او العنف الاسري فيكون تاثيرات. وهذا التغيير قد يكون نوع من النيوروبلاستيسيتي اللي هي نوع من الصلابه العقليه او الدماغيه، اللي هي انه الدماغ يغير نفسه حسب الحاجه في اجزاء او وظائف يعطيها نوع اقوى انه يعتبرها ضروره اكثر، اللي يحب يطلع على المواضيع اللي جدا فيكون اقوى بهذا الجانب من جانب اخر، مثلا كونه انه يعتبره اكثر اهميه.
شكرا. And then the seventh point is something that they don't know too much about. So how reversible are these changes? And the Romanian orphanage study showed that that example was reversible with the neglect being in an orphanage. They did find reversible changes, and they're talking about a future study that the team are planning to do to see if mindfulness helps.
الاستنتاج السابع انه غير واضح هذه الامور، يعني كميه او كيفيه عكسها او علاجها، يعني غير واضح انه شنو الامكانيات وشنو المطلوب. كمثال انه الدراسه الرومانيه للايتام الرومانيين كانت تظهر انه هذا الامر امكان علاجه او عكسه، بس هذا الامر مو واضح ونحتاج دراسات مستقبليه اكثر حتى نعرف شنو المطلوب وكذلك شنو النتائج. We missed the fifth conclusion, I think.
I thought so. Sorry. Sorry. Yeah, I thought fifth. Where is it? Third, fourth, fifth. We did miss the fifth. Sixth. Oh, Yeah, sorry, the fifth is important. Is an interesting one, about the differences in gender. So they've said different examples in different genders. So, for example, in boys, the corpus callosum is more affected. That's the bit that connects both sides of the brain. And in, again, hippocampus is more affected in males. But in females, there are areas which are more affected. So between the anterior cingulate and the hippocampus or amygdala, so the connectivity. So I was wondering whether that meant that maybe, or it's not really saying the amygdala is more, but it's the connectivity.
On the other hand, the resting state functional connectivity between the anterior and amygdala may be more rarely observed in females. I think it says it's more effective.
Yeah.
يعني هنا الاستنتاج الخامس انه اكو اختلاف ما بين الذكور والاناث بالتاثير مثلا الذكور الهايبوكامبس متاثر كان اكثر حسب ما ذكرنا انه بالبدايه كان اكو نوع من المتعلق بالجينات.
Yeah, I think it's saying the connectivity, but we don't know what the clinical significance of that connectivity is.
بالاناث مثلا كانت الاميجدولا مثلا و الاميجدولا متاثره اكثر، كذلك الجزء الامامي من سينجوليت هايبوكامبس. طبعا مو واضح كلش التفاصيل،
واضح. Yeah.
الزملاء اللي يحتاجون تفصيل اكثر يقدرون يرجعوا لي الوقت يبحثون، بس الاستنتاج النهائي انه اكو يعني استجابه الذكور بانه نسبيا اكو اختلاف عن الاناث، استجابتهم اجزاء معينه بالدماغ الذكور استجابتهم في اماكن معينه، وهذا من عنده طبعا انه قد النتائج تكون مختلفه نسبيا. Is it right, Dr. Yasmin, that the result will be different? Impacts will be different between males and females. Or
Yeah.
The symptoms, signs and symptoms will be different. Yeah. The presentation will be different. Yeah.
That would make sense. And I guess that you think that men sometimes present differently to women. So children, they talk about girls having internalizing behaviors, boys having more externalizing behaviors. And then in men, they may present differently. I think it would be good to read through the paper specifically to find all the areas where the females are affected and the areas that the males are affected, because it does talk about the different areas. So for the more specifics.
قد يكون هذا هو ينتج اللي هو اختلاف ما بين الذكور والاناث. مثلا الذكور دائما نقول يظهرون هذه الاعراض او المشاكل، بينما انه شيء خارجي يكون او اظهار، بينما النساء اكثر الى انه ادخال الموضوع او كبت الموضوع. That's not correct. They keep it inside. They don't talk about the females. Yeah, is that what I mean?
Sorry.
By internalize the like
inside, keep inside. Yeah.
They keep it more inside. Yeah.
Yeah.
قد نشوف بعض حالات النساء انه الكابتن هذا الامر وما يترجمني على عكس الرجال.
Yeah, this is something I remember learning about younger children, but I'm not sure if it applies to adults.
صارت مع الموضوع حسب خارج الوقت يحتاج تدخل اكثر ونستنتج اذا كان هذا هو المقصود او النتائج. طبعا الموضوع اكيد بتوسيعه.
That would make sense with what Dr. Zainab was saying about the higher rates of domestic violence being from males. So that would be an externalizing behavior. So it may.
قد يكون مثل ما ذكرت دكتورة زينب قبل شوي انه نسبة العنف الاسري اللي يكون من الذكور اكثر بسبب هذا الشيء، انه الذكور يظهرون هاي المشاكل خارجا على عكس النساء اللي كثير. in addition for the like social like impact إضافة طبعا للجوانب الاجتماعية المشاكل الاجتماعية اللي تعطي نوع من التحيز للذكور يعني على هذا الموضوع.
The cultural influences, yeah. So it could be cultural rather than biological.
Or both of them, like highly
Both, yeah.
mixed. Yes.
Exactly. Things are usually a mixture of causes. And then the last point, which is what we were talking about, to think of it as a separate group of maltreated individuals. So it might be their theory, but also they're saying that there's some evidence saying that the changes might not be in individuals that have mental health disorders but have not had maltreatment. So they're saying to keep the groups separate, and that the impact of the maltreatment on the brain changes is that the maltreatment is what causes the brain changes, rather than necessarily because that they will have depression because they have a brain change. And they've tried to come up with some theory of why some people who have maltreatment do not go on to develop disorders. So they said their resilience might cause them to adapt in a certain way, but they haven't said what these adaptations could be, just compensatory changes. And they're saying that this will be something to look at in future studies.
استنتاج أخير أنه ربما وسمعت واضح جدا أن السبب هاي التغيرات أثرها مو الجانب النفسي، ولكن بسبب هاي الأمور بعضها أدى إلى في بعض الحالات إلى مشاكل بالتغذية، ومشاكل التغذية هي اللي أنتجت هاي التغيرات في الدماغ. يعني كانت أنه بسبب بيولوجي مو سبب هاي طبعا في احتمال ما ذاك انه تفاصيل اكثر انه البعض منهم قد يصير عنده نوع من التحمل، البعض الاخر ما يصير عنده نوع من التحمل، قد يكون هو هذا السبب انه نقص التغذيه، بس ما ذاك التفاصيل اكثر، واكيد يحتاج لدراسات اكثر مستقبليه حتى نناقش هذا الموضوع ويعرفنا.
Yeah, so he is saying that there is good evidence that the changes are not there in people with, for example, depression who've not been maltreated. So it's saying restricted within the maltreated group. So that's
اكو ادله جيده تودينا انه طلعوا الموضوع الى انه مثلا الاشخاص اللي صار عندهم نقص تغذيه مع الكآبه او بدون كآبه متاثرين انه اكثر من مقارنه بالاشخاص اللي صار عندهم كآبه بس ما صار عندهم نقص تغذيه. Is it correct what I said, or I just said what I understood, that those who had malnutrition, malnutrition or maltreatment?
maltreatment.
Maltreatment. Oh, okay, I just concept mistakenly. عفوا مو نقص تغذية، إنه سوء علاج، نقص علاج، إنه الأشخاص اللي ما تم معالجتهم أو ما حصلوا على العلاج الصحيح تأثروا بالموضوع أكثر من الأشخاص اللي تعرضوا من نفس الأحداث، مثل موضوع الكآبة مثلا أكثر صار تأثر من اللي so those who had maltreatment had worse situation or more obvious evidence compared with those who had treatment. Yes.
So maltreatment means the abuse. So those who had the abuse, they had the brain changes, but those who didn't have abuse but still have the mental health condition, they don't seem to have the brain changes.
Like what? I didn't understand. Like maltreatment, I understood like maltreatment, no treatment, or
Sorry, no, mal comes from, I think, a Latin word of bad. Or so
mistake by translating mistake.
that's okay.
عفواً أعتقد ترجمتها بشكل خاطئ. So what does it mean maltreatment here?
So maltreatment refers to the overall abuse, so sexual, physical, emotional abuse, and neglect. So all of those are covered under the umbrella of maltreatment.
So compared with whom?
So معاملة غير جيدة is maltreatment.
Has good treatment, yes?
No, it's so some of the studies might have comparisons. But some of them might not.
Okay, maltreatment in comparison with whom? The other group, what?
Oh, the other point that we were saying.
They said those who had maltreatment,
yeah,
they tend to have worse situation in comparison with.
Okay, yeah. So the final point talks about this. Those who had maltreatment, so mu'amala muziyana, they have the brain changes, but those who didn't have abuse in childhood, but still had depression or other mental health disorders, they don't have brain changes, even though they have psychiatric problems. So it seems that the brain changes come with the maltreatment.
بالترجمة هنا قصتهم كان سوء التغذية أو سوء العلاج وفيها سوء المعاملة. الكلمة تحمل أكثر من معنى إنه الأطفال اللي صار عندهم سوء معاملة أو أي نوع من أنواع الاعتداءات الجنسية النفسية الجسدية الفكرية خلينا نقول بين إنه عندهم تغيرات بالدماغ بشكل واضح مقارنة باللي عندهم مشاكل نفسية أخرى عندهم مثل كآبة بس ما تعرضوا إلى سوء معاملة. قد يكون السبب استنتاج هذه الورقة إنه سوء المعاملة هو اللي أنتج هذه التغيرات بالدماغ.
صح، شكرا. وهذا نقطة مهمة جدا مهمة لأنه يكون العلاج يساعد واحد إذا عنده مرض نفسية وما يساعد غير شخص عنده مرض نفسية، والسبب يجوز لأنه الدماغ يختلف بين هذين الأشخاص، فالعلاج مفروض يختلف، مو بس نشوف كل واحد اللي عنده كآب نفس الشخص يحتاج نفس العلاج. نحتاج نفكر شوية بعد بالريسيرش ونشوف نسوي علاجات more specifically for certain groups. So not treating everybody the same, but making a treatment that's specific for people who have had this mu'amala muziyana and having a treatment for people who have not had abuse in childhood but have this condition, so that we give them more accurate and more appropriate treatment. So that's quite important for clinical practice.
وعلى نستنتج من هذا هو الأطفال أو الأشخاص اللي يصير عندهم مشاكل نفسية مع سوء معاملة قد يحتاجون إلى نوع علاج يختلف عن الأشخاص قد بنفس المشاكل أو نفس المشكلة بس بدون يعني أي سوء معاملة. فهنا نحتاج إنه هاي الأشخاص نعطيهم علاج خاص بهم، وهنا نحتاج إلى إنه أبحاث أكثر واهتمام أكثر بهذا الموضوع حتى إنه هاي مجموعة يكون لها علاج. مثلا كآبة في طفل ما عنده مشاكل ويا سوء معاملة مقارنة بكآبة نفسها بطفل عنده مشاكل سوء معاملة، قد هذول ما يكون علاج نفس العلاج، راح يكون واحد له علاج يوازي أو يناسب حالته حتى تكون الاستجابة صحيحة. وهذا اللي ينتج لنا قد هنا اختلاف الاستجابة بين طفل وطفل.
شكرا. أشتديك على الترجمة، أشتديكم اللي بقيتوا سمعتوا، يعني طولت عليكم العفو. أنتوا ساعة بيش أساسا تخلصون؟
اوكي لك ماكو مشكله، اهم شيء الموضوع نقدر نغطيه بشكل جيد. الحمد لله، يعني شكرا لكم دكتوره على التقييم الممتاز والرائع، يعني اختصرتوها رغم انه الورقه جدا كبيره، ولكن الحمد لله قدرتوا تقدموها بشكل جيد ان شاء الله للاغلب. بس الزملاء اللي يحبون كمداخله يا ريت يرفعون ايديهم حتى بس يسمعون انه تنبيه الي حتى اعرف اللي حبي كمداخله، سواء على الورقه البحثيه نفسها او كموضوع نفسه، شلون نقدر نستفاد به الجانب خلينا نقول العملي، بحيث نقدر نستفاد. طبعا دكتوره زينب، هاي كم اب لو تمام لو انه سؤال عفوا.
العفو، يا هاي الإشارة يعني هي هاي غير بدي أشترك له.
تمام تفضل. اي نعم تفضل.
السلام عليكم. شكرا جزيلا دكتور، شكرا دكتور، شكرا للكل. Regarding the last point about the resilience, I want your opinion about that there is a theory in child psychiatry about the resilience that comparing children with like flowers, certain types of flowers. Children's like two types of flowers, as I remember, the orchid and the dandelion. That some theories said that some flowers like the orchid need specific circumstances to grow and to to get still alive. But the other type, which is the orchid that grow in every circumstance, even difficult condition of weather. So children are like these flowers. Some children or both children, many children exposed to the same stressful conditions, but some are developing the disorder like PTSD or attachment disorder or something like that, and other children are not developing that. And we need another lecture or another researches about that, about the resilience, why these children are not developing and those children are developing. And as you said, many causes as biopsychosocial condition are collecting that make them different. But still there is no certain specific cause for the cause of resilience to some and the other. And my other and last note about the Romanian studies, the orphans, that as I understand that the child since the birth need a caregiver that is sensitive and existence and available for the child, for him and her, since early childhood, and make that organize his feeling and give him support and help him. So when there is the disappearance of the caregiver, like in as you said, in neglect, or that the caregiver is suffering from psychiatric disorder or is suffering from addiction, like in many other the Western society. So the child will not be regulated his would not find someone who regulate his organize his feeling, and he will not develop securely attached to the caregiver. So that will lead him to develop later on the other condition like borderline personality disorder or other psychiatric disorder or attachment disorder like reactive attachment or disinhibited social engagement, like that in the Romanian orphans. So they took the children and put them in a sensitive caregiver, and find that after exposure them to the sensitive caregiver who adopt them well, they many of them became better, and the disappearance of most of the disorder from them, and their conduct or externalizing behavior all were ended. I don't know if you correct me if I'm not was wrong.
لا أحسنت شكرا. Two very important points, big points and very important points. So the first one you're talking about, there is a nice analogy. I'm trying to look for it and see if I can bring it up, but it's between the dandelion and the orchid. So those who do gardening, or I don't know if you have orchids and dandelions in Iraq, but oh, you don't? Okay. So the dandelion is like a weed. It's very resilient. It grows everywhere, and it doesn't really take much effort to grow easily. Whereas the orchid is a very delicate flower, and it needs a lot of care and attention in order to help it grow and progress and be as beautiful as it can. And people think of the orchid as more beautiful and less common, more unique than a dandelion. And so but they make this analogy to compare with children. So there are some children who they have resilience and they can go through a lot and it doesn't affect them too much. But there are some that are very delicate, like the orchid. And under the right conditions and right support, they can be so beautiful. But they're also very sensitive and very delicate. And if under the wrong conditions, they can really suffer. So we see that human beings have so many different personalities, but this is just a broad way of separating them. And so it's an interesting question: what makes somebody delicate? What makes somebody resilient? So it's a mixture of factors. Like within psychiatry, everything's a mixture. So it can be the genetics play a part. So somebody might, like we mentioned earlier, somebody might have a specific gene that makes them more vulnerable to a certain condition. Temperament as well. So they say that some infants are more fussy and need more attention than others. Also their emotional surroundings that really affects resilience. So maltreatment, being treated badly, abuse, that reduces resilience, makes somebody more vulnerable in the future. And there are things that increase resilience. So having a supportive network around, that's very important. So that can be support from family, friends, professionals, having a good attachment initially that strengthens resilience, having, for example, good opportunities and good role models, religion as well. That's something, especially in Western psychiatry, that's really left out in Western psychiatry, and it's such an important aspect. And I like to use the biopsychosocial spiritual model, not just biopsychosocial. So the spiritual is a very important aspect, and alhamdulillah, Islam gives us so much resilience, so much, and it's a shame that it's often left out. And the resilience factors can be from early on, but they can also be things that people can modify later on. So yeah, they can be more spiritual later as an adult. And there are other things as well, like exercise. So I advise a lot of the children I see to have a healthy, balanced lifestyle that will help. So having hobbies, speaking to friends regularly, and healthy relationships as much as they can in terms of family relationships. That can be difficult, especially with teenagers, though. Good sleep, good diet, all of these improve our resilience. And some of the resilience factors we can't change, like our genetics, some of them we can improve on. But it's an important and interesting area, because what makes somebody suffer more, what makes someone suffer less. But also our experiences make us who we are as well. So I think that's what the orchid analogy shows, that somebody who can be delicate and not have much resilience, they can come out under the right conditions as really something so beautiful and so spectacular. And you see a lot of people, some famous people who've had difficulties, but they flourished. Like Einstein, he had autism, but under the right conditions, he became someone spectacular. So often we think of these labels as weakness, but actually they can become a strength. And this is something that's important as well for young children, for children and adolescents. When they get a diagnosis, they may feel really bad about having a diagnosis, and I see a lot of children that think that there's something wrong with them, and it affects their self-esteem. But if we can help encourage them with this beautiful analogy, and say and tell them of people who have succeeded, and there's many examples of people who have difficulties and they've become really spectacular. So thank you for that, your first point. And your second point reminded me of something that we had to learn for our exams, for the board exam, was some facts. I think it was so for the membership exam, which is our version of board, it was in the first year. It's really important for the primary caregiver to spend 20 hours with the infant a week. So they weren't saying that it mattered who the primary caregiver was, whether it was the mother or for example, if they've been adopted, someone else, but that they have this 20 hours a week. And this is a problem in the Western world as well, because a lot of mothers, they give birth and then after 3 months they go back to work. So they can do 20 hours, maybe with part-time work, and then but sometimes if they go back full-time, then they don't see their child for 20 hours a week, and this impacts on the attachment, and that's something that's relevant as well to the orphanages, because who is their primary caregiver? Who is that person that they form this attachment bond with? They don't have this person, and some orphanages are better than others. So there's like in Tanzania, there's a group of Muslims that have set up a charitable orphanage where they aim to look after them, whereas we hear horror stories of more abusive orphanages with bad conditions. So that can also depend, but the attachment and having a person to form an attachment with is very important in helping them develop their personality. And it's important for so many conditions, but I've heard personality disorder, particularly borderline personality disorder, described as a disorder of attachment. So that can impact later on. And the reason why it might be described as a disorder of attachment is they had attachment problems as an infant. So they had things to cause them. So that is another lecture in itself about attachment, and inshallah we will do that, we will cover that. But they had insecure attachments, and then that develops later, and further trauma adds to it, and also can cause them to dissociate as well. And with borderline personality disorder, one of the diagnostic criteria is relating to relationships. So we learn that early relationship from our attachment, and then if we haven't learned that properly, it affects our relationship with other people. So someone with this might often get into conflict with others. So when I say relationship, I mean everything, not just marriage. So the way they relate to a stranger, the way they relate to friends or teachers or people around them, as well as partners. So they can have really intense and unstable relationships. And I'd be interested in hearing more about the situation, how it is in Iraq, because I know I know some of what the situation is like in the UK, but I don't know too much about in Iraq, because obviously there are cultural differences, religious differences, war, different trauma as well. So negative and positive differences. I think there's a lot of good in Iraq, but a lot of negative as well that's happened. So I'd be interested to hear how the Sha'ab have developed as well. But yeah, thank you for those questions. for those points.
Doctor, if we compare it to other, like, not realistically, how can be this done? For example, if the theory about the impact of corticosteroids on the hippocampus and amygdala, if it's the reason, and if it have the same impact, for example, like when we have type 2 diabetes, which is because of high insulin and decrease of the receptors sensitivity for insulin, there's some change. When we do some therapy like psychological, for example, stress management and some nutrition guide, this resistance will change in a time, like a few months to even a few years. There will be some change that the body will increase its receptors. When the insulin decrease, sugar decrease, then the body react by increasing the receptors. Theoretically, can this happen the same with the hippocampus and amygdala, that when the corticosteroids decrease because of decreasing like the stress, which can be by the therapy, for example, then as a result, maybe happen that the body or the hippocampus will come back for its normal size, especially maybe I think even it will be more affecting or impacting or effective in the early years of like childhood. Yeah. So let's say that mean like the earliest therapy is the best results.
Yeah.
Yeah.
No, it's interesting thoughts, interesting. So that's one of the, I think, beauties of psychiatry is and mental health is that the brain is neuroplastic. Obviously, it's more neuroplastic when one is younger. So the earlier intervention is more important and more likely to give a change. This is why child and adolescent psychiatry is so important, and I'm so happy to see trainees here. And so I think it's a really important stage of intervention. But even at older ages as well, therapy works. And I'm not sure how strong the evidence is or how much evidence there is out there. But what I know, or what I think I know, is that with therapy, like especially things that go over the same thing again and again, you're building new neural pathways and you're strengthening those neural pathways. So then in that way, if the nerve wants to fire down, for example, a bad thought or a positive thought, if you've strengthened the positive pathway, it's more likely to follow that one. Whereas so this is a concept in CBT, for example, when somebody has some negative assumptions about themselves, they call them, there's different levels of that unhealthy thinking. So there's the negative automatic thoughts that come automatically, there's the assumptions, and there's the core beliefs, which are deep down and they're harder to get to and harder to change. But the idea is that you don't get rid of these, you don't get rid of your core beliefs, but you provide a healthier alternative, because you can't get rid of it. So you provide a healthier alternative and you strengthen that, so that when you're in a situation and you have to think of something, your brain is more likely to go down the positive path if you've practiced it and you've strengthened that pathway. And the other part of your question was about so the paper was saying that I can't remember which one. I think one of them was the reversible one. So they've seen some changes are reversible. I think it was the hippocampus that was reversible, but the amygdala was not as easily reversible. I'm not sure. We have to go back to the paper for this. But the brain can change, but it is easier to change when younger, but it's not impossible to change when older. and it is better to invest in earlier interventions, so treating younger. And I think this is one reason, but there might be other reasons as well. So they get into habits, their brain is more plastic at a younger age. But I think also as somebody grows older, they pick up bad experiences, because if somebody has been abused, then they might be more likely to put themselves unconsciously in a position of abuse. And so as they grow older, they build up worse and worse life experiences. So the earlier you can intervene, the less they can add to the traumas as well. So I think there's many reasons why it's important to intervene earlier. You're on mute, sorry, Dr. Abdullah.
Yeah, but still that what we see by the neuroplasticity, and also that the ability to changing habits, like I think it's like something we can observe it by all age, that they can change habits, stopping like some habit or starting new habits. This give us like some hope, although yeah, the younger, the easiest to build a new habit or stop a habit, but still possible even with the late age. As you said, this neuroplasticity phenomena, or even like theory, or even now can be like, I think it's almost true, a fact that neuroplasticity is possible, like to make a change in the brain. Yeah.
Yeah, no, it is possible even as older. Yeah, because people do have treatments when they're older, and it does work, but it may take longer and it may be harder. It's better to do it younger, to start younger. And Zainab has mentioned epigenetics. Yeah, epigenetics is very interesting. So just in case not everyone knows what epigenetics is, but it's my understanding is that it's you have your genetics. Not all of it is expressed, but depending on the environment, some might be expressed. So it's not as simple as the like traditional Mendelian inheritance of autosomal recessive, autosomal dominant. If you have this chromosome in autosomal dominant and it's expressed and it's got full penetration, then you will have that trait. But I think epigenetics is the interaction between the environment and the genetics. So it affects the expression. So it can stop it from being expressed, or it can make it expressed. And I'm not sure. Yeah.
It means like a predisposing for the factors. So this genetics make people like closer to be reacting this way. Like than others, like for example, they just increase the risk about moving to this reaction. Is it?
Were you asking me or explaining?
Yeah, I just asking, like, if it is it like that, it's more like to make the individual closer for this this side, let's say, to react more emotionally or logically. So this genetics will make this person in such situation closer to react this way, not that way.
Can I ask?
Yeah.
Can I answer? It is in its simple words. It is habitable changes in the genetic expression without changes in the genetic makeup.
Shukran, Zainab, you said it more clearly.
Now it is more difficult.
I thought that made it more clear. It sounded more clear.
بعض الصفات واحد ياخذها بدون أن تتغير الجينات مالته من البيئة يعني.
مثل, for example, let me just give a random meaningless example. But for example, say I have an angry gene in me. This I don't think it exists, but say I have an angry gene, but it's not expressed, and so I'm a calm person, even though I have this angry gene. But if I were to go into an environment that brings out the anger in me, then suddenly certain molecules are added on to my genetics, so they call it methylation, and so it makes the mRNA now read that gene, and that gene is expressed. So now I'm an angry person.
Okay.
That's epigenetics, the impact of the environment on the genes.
Well, clear.
Cool. It's an interesting area. It's a new area, but
exactly, yeah, and more complicated than just describe it in a few words.
Yeah, absolutely. Yeah.
I think if there's no other question, like we already took a lot of time from Dr. Yasmin.
That's okay.
دكتور ياسمين، شكرا لكم وعلى وقتكم وعلى تقديم الرائع، وإن شاء الله نشوفكم في جلسات أخرى. شكرا للزملاء الحضور اللي شاركوا ويانا. شكرا دكتورة زينب على مداخلاتها القيمة. شكرا للزملاء في مركز الدمى العدلي اللي استضافوا هاي الجلسة في جامعة النهرين، دائما السيد رئيس الجامعة والدكتور ضياء شامخ مدير مركز الدمى العدلي، الدكتورة رشا وكذلك السدانية. شكرا لجميع الزملاء اللي يتابعونا أيضا من اليوتيوب مباشر، اللي ما يقدروا يحضرون على الزوم. وإن شاء الله نشوفكم في جلسات أخرى واستفادة أخرى. احنا جلساتنا كل يعني بين جمعة وجمعة تقريبا نفس الوقت، وإن شاء الله نقاش أوراق بحثية قادمة.
إن شاء الله شكرا، وشكرا بقيتوا وسمعتوا، وإن شاء الله استفادتوا.
شكرا لكم وتصبحون على خير.
شكرا على اشتراككم. شكرا دكتور عبد الله for organizing this platform.
كل سرور.
شكرا. الله معكم. مع السلامة.
في أمان الله.
في أمان الله.